Hello everyone, it's Dr. Gupta at the Dermatology Laser and Vein Center, and today I'm going to talk to you about hyperhidrosis. So this means excess sweating, and a lot of our patients present with this problem. They're embarrassed because they're sweating at times where they don't want to be sweating, and at important functions or times in their lives, or they're sweating constantly. And this is a diagnosis that can affect the underarms, it can affect the hands, the soles of the feet. It can also affect the scalp and the hairline. So those are the most common areas where we see hyperhidrosis, but it can also present in the groin and the chest area for patients. And to treat hyperhidrosis anywhere on the body, the most beautiful and best treatment is Botox. It's simple, it's easy, it's effective, and it always works. And it just requires a few little needle injections and can control the sweating from anywhere from 3 months, sometimes even up to a year. It's partly dependent upon how a patient responds to the treatment, and then also the number of units that go in. The greater amount of units we place in an area, the longer it tends to hold. We have plenty of sweat glands all over the body, so getting rid of a few sweat glands, let's say in the underarm area or specific parts of your body, is not going to mess up your ability to get rid of toxins and control your internal temperature. Before we treat an area for hyperhidrosis, we often like to do a starch iodine test where we can put some iodine on the skin and then some cornstarch over that. And when there's moisture that builds up in the area from sweating, it actually turns the area black. And it really helps us localize where those sweat glands are isolated and located. So for example, if we're injecting Botox, we know exactly where to place that Botox, and we're not wasting units and Botox in areas where you don't have a problem. We can also permanently get rid of sweat glands. And right now, the only place where we can do that on the body is really the underarms. But hopefully with time, we'll have more permanent solutions even for areas like the palms of the hands. But right now for the underarms, we have some treatments like ThermiDry, or actually we can even use Accutite now, where we put a little probe under just local anesthesia under the skin. So it's a completely painless procedure. It delivers a dose of radiofrequency under the skin, and it helps to disable the sweat glands and also the apocrine glands, which cause odor. So it helps to eliminate both the sweat and the odor from the underarm area, and usually works very effectively after a single treatment, but some patients may require a second treatment, possibly even a third, depending on the response. But like I said, the majority will do quite well with just a single treatment. We can also do fractional radiofrequency treatments with something called Morpheus 8, where there are little needles that penetrate through the skin and deliver a dose of radiofrequency. Again, same idea. We're just trying to disable and get those sweat glands to shut down and those apocrine glands to shut down. Neither of these treatments will affect hair growth, so you will continue to have your normal amount of hair in the area. I should mention also we can do vasoliposuction, which is essentially a liposuction procedure in the underarm area, and that also actually works really well against excess sweating. Thank you so much for watching. I hope that was informational for you. Look out for more content from us, and do share, like, and comment on our videos. Thank you so much.